Hello, I'm Marco Fiore. I'm a surgical oncologist in Milan. I work in the Sarcoma service of the National Cancer Institute, and I'm delighted to be the director of the ESSO initiatives of the European School of Soft Tissue Sarcoma Surgery. The ESSTSS, the School of Sarcoma Surgery, is an initiative that has born because the training in surgery of soft tissue sarcoma is very difficult, and we have to deal with a rare disease. So for the young surgical oncologist, it is extremely difficult to find experienced centers and to have some insights in the disease. So we think about this initiative essentially as an education and training program. The first problem is that soft tissue sarcoma is a rare disease, so it's rarely encountered by the surgical oncologist. But the second very important point is that the surgical technique, the surgical approach is very specific. I mean, the general training on general surgery or general surgical oncology is not enough to be able to treat soft tissue sarcoma at their best possibilities. And moreover, over the last years, the surgical approach has evolved. So we have now a new technique, especially in the approach to abdominal sarcoma, retroperitoneal sarcoma. The surgical procedure is very demanding, and now is well established that a new surgical approach that is including multivisceral resection, so very compelling procedures has to be done, and this will improve the outcome of patient. But obviously we need more training, and we need that this will be diffused. So we put together some European referral centers for sarcoma surgery in different countries. In Europe, we have Italian centers, we have centers in France, the Netherlands, and the UK. And essentially, the participants has the occasion to visit more than one centers over the period of the school, and to be introduced to different approach and different strategies, and obviously in all high volume centers, the biggest high volume centers in Europe for this disease. So the school is meant to be addressed to young surgeons during their training, or a junior consultant in surgical oncology working in those places where a sarcoma program needs to be built or developed or expanded. So essentially they will spend over 2 years some visitorship in the centers of the school. They can customize their pathway and their own program. They will be received tutoring for 2 scientific research projects, and the application is very easy through the ESSO website. The candidate can submit the request, and I would underline that ESSO has provided a scholarship, a yearly scholarship that would cover the cost of the school for the best candidate of the year.